some of the clients who do come for cardio consult lodge complaints. They have been compliant to their blood pressure medications, but their BPs are not subsiding. So what could be the possible cause?
So this is also termed as resistant or refractory hypertension. We have another term called pseudo-resistant hypertension. The difference between them is that resistant hypertension, new guidelines defines that as blood pressure systolic of 150 and above and diastolic of 90 and above, having been compliant on your medications. I'm stressing on the word compliant because patients might say they take their medications and they're not really compliant on. So that is resistant hypertension. Now, pseudo-resistant hypertension is also called the white coat effect. That is when patient actually comes to the hospital, blood pressure increases, elevates at hospital and at home, BPs are very normal. So as a physician, we need to be able to distinguish between these two and manage accordingly. So if it's a pseudo-resistant, we wouldn't actually modify the dosages or the blood pressure medication combination, because obviously we know that it's stress-induced, so patient is fine at home. However, if it's a resistant hypertension, that is, blood pressure has been, patient supposedly is compliant on his or her medications and also living lifestyle, very good lifestyle modification and dieting, we want to now follow up to actually get to understand why it is high despite taking this medication. One of the reasons is, patient education. We sometimes do not have more time to explain the situations or the drug, dosages to the patient. So when they go, they probably would take underdose. They're supposed to take the medication BD, that's twice daily, and then they'll go and take once daily. And then you think you are giving them a full dosage of the medication, and then they are not taking it accordingly. Now this can result in resistant hypertension. Others can also be when patient is actually non-compliant but comes to the hospital and tells you they are compliant on the medications. Some are also secondary causes. So secondary factors can be thyroid, heart diseases, adrenal gland tumors, and other kidney pathologies or kidney diseases, renal parenchyma diseases, renal artery stenosis, and all that. These are all secondary causes, which if and when we are able to diagnose appropriately and manage, most of the time the patients are blood pressures are able to be normalized without the medications. So we look at a lot of things to be able to make diagnosis. That is why it is essential that the patient will always follow the proper regimen of the medications.